will get to the Q&A session, but I want to ask one last question to Dr. Chin. So it's almost like a Goldilocks type of thing, right? Where you do forever for your adjuvant TKI or your adjuvant, I guess I would say, or consolidation TKI, or you do 2 years or you do 3 years. I have some patients who struggle with the concept of stopping it if it's working. So how do you think as a field we can sort out that type of question, and what is your practice surrounding the duration of TKI?
Yeah, I think that's an incredibly challenging scenario. In Alina, it was 2 years. In Adora, it was 3 years. But then in Laura, which is for stage three, it was indefinite. Um, I think this is where that perhaps some of these high risk features that Dr. Hotel talked about in her talk may come into play, right? So if in this setting of EGFR, and I'm sure we'll see more with ALK as well, if your cancer has one of these more high risk features, might you benefit from a longer consolidation period or adjuvant period? This is also the role of perhaps doing that plasma testing, as she was just talking about as well, because, you know, there's a lot of studies that is retrospectively seeing that if you don't have ctDNA that's detected, or if you have clearance ctDNA, that's a really positive prognostic factor. And so perhaps if you do have that ctDNA clearance, we can get away with a shorter time of consolidation. And this is actually conversations we're having with our patients as they're approaching their 2, 3 year mark is, well, what do we know so far? What do we know about the risk features of your cancer? And then how are you tolerating the therapy, right? If they're struggling to get to that 2 or 3 years, and I say, you know what, we've done our best, we've done what this trial recommends, I think we should stop. But if they're doing incredibly well and they have some of these other features, or if we can detect ctDNA positivity still, that might be the patient we talk about extending their period of adjuvant or consolidation.
Yeah, I think very, very kind of great answers to questions that are unresolved in the field. But it's good to have to have the opportunity to ask these questions now with the kind of evolving therapeutic landscape.